Hi everyone, today we're going to talk about pharmacology. We're going to focus primarily on drug administration, as in what route should a drug take to get into your body and why would we choose one route over another. But what is exactly pharmacology is simply the study of drugs, and we're going to include the interaction that our drugs have inside the body and with each other in that science. It's a very high-paying science, but it does require a lot of chemistry. One thing that you might note in pharmacology is that each drug really does have multiple names, sometimes even 3 different names or more. It has a chemical name which describes the actual chemical composition of the medicine, like naproxen sodium is an example. The generic name, the more commonly used name for the medicine, like ibuprofen, or the proprietary name, the brand name, such as Advil or Tylenol. Each of those are important to remember because individuals can remember just one name, and we as healthcare officials would need to remember all the names so that we don't accidentally give our patients something they might be allergic to. And a good example is my wife is allergic to zithromycin, a type of antibiotic. Well, when she had strep throat one time, her doctor tried to prescribe her a Z-Pak, which is the proprietary name of, you guessed it, zithromycin. She would have been very, very sick, and she would have had an allergic reaction, which would have been bad, bad, bad. Now, when we're talking about drugs administration, we really want to worry about how to get that drug into the body. And one category, a big category, is through an enteral route, a route that goes through the GI tract so that our small intestine can absorb the chemicals from the drug itself. Now, we can take a drug orally, which is always good because we know how to swallow pills and cough syrup and all those different things through the mouth pretty easily, and it can be absorbed through the stomach and small intestine very simply. This is a good option for things that are long-lasting because they can disintegrate slowly inside of our digestional tract. But if it needs to happen really quick, it might not be the best thing ever. There's also sublingual, which is a little bit faster, but these are medications that have to be shelf-stable because they're going to dissolve underneath your tongue only to the contact of your saliva, so we keep them dry as much as possible. Rapid action for sure because the oral cavity has a lot of blood, but it is something that's going to be hard to stick underneath your tongue. Chewing tobacco is technically a buccal drug administration because it goes into the gums and cheek from the tobacco itself. All of these are quick compared to the oral administration, but not long-lasting. There are also parenteral routes. Para means beside or around. And so if we're going around the GI tract, instead we're going to go in through injection or some other means outside the GI tract, which is very good for an immediate delivery of a medication. Injections are really good to get the drug into our body directly because it goes directly into the bloodstream. One kind of injection is an intradermal or ID injection. This would go directly below the epidermis into the dermis of the skin. You don't need to know the layers of the skin. Just know that the epidermis is the most higher layer, the closest layer to the surface, and the dermis is just below it, and there's a subcutaneous layer followed by muscle right underneath of it. This is a good one for allergy skin tests because those particular tests are visible to us when they're on top of the surface of the skin, so intradermal is really good for that. Subcutaneous medications go below the dermis and into the fat deposits in our body. This is really good for insulin injections, so individuals who have diabetes and need to inject insulin themselves are getting a direct subcutaneous injection. The intramuscular, or IM, is what you would imagine with a bunch of vaccines and stuff that needs to be administered deep into the tissue because it's going past the skin, past the fat tissue, and into the muscles, such as in the shoulder, thigh, or hip, or even the butt. There is also going directly into the route into the bloodstream, trying to get an intravenous injection, just like you guys practiced on my mannequin arm back in first semester, the IV injection. This will go directly into the veins using a needle, of course, and this would be very fast, and as long as the person who's doing the job knows how to get it into the veins, not very painful, but it is something that takes a lot of practice. So it's not advisable for individuals who are going to be doing this on their own. This is just a demonstration of all the different layers and the angles at which we use for these kinds of injections. Notice that intramuscular, the ones that go deepest, have a straight up and down injection versus intradermal, because we only want to be in the epidermis and not necessarily the dermis. We lay it on the side so that it doesn't go deep into the tissue. Now, there are other routes of administration that are parenteral. Transdermal medications are going to be applied directly on top of the skin. These are your creams, your ointments, your lotions, your sprays, your patches, anything that's on the surface of the skin can be absorbed through the skin and into the bloodstream. It just tends to take a little bit longer of time, but it's good for things that might not taste so good, such as nicotine patches and stuff like that. There are ophthalmic routes of administration. Think of your eye drops and other medications that would go through the eye. Otic will go through the ears, specifically those that have ear infections are really good for this. These are both pretty fast acting. You don't really need to wait on it, but they are pretty localized. They're not really hooked up to the blood supply as well as the blood supply itself, so we're not going to put anything dramatic into either of these spots that needs to be transported throughout the body. Really, we're just going to treat the eye and the ears. Nasal, on the other hand, does go into the respiratory system, which does allow your bloodstream to pick it up when you have a breath. So things like nose sprays are really good for respiratory tract infections, as well as some inhalants such as albuterol for asthma and stuff to open up those tissues very easily. Speaking of, there's an inhalation there. These are typically delivered by aerosols, but you can also have something called a nebulizer, which vaporizes the thing right away and puts it into the air that you can go ahead and suck on. And smoking technically is an inhalation route of administration as well. Very fast, very effective, but it does require you to use breath, and that does stop an oxygen flow for just a second or two. There's always the option number 2, or our last option on the list, rectal. We can have a suppository, which would actually go into the rectum and be absorbed by the bloodstream there. Your rectum actually has a lot of tissue that has blood vessels right next to it, so this is actually a pretty quick and easy way to administer drugs, but it's not necessarily the most convenient way or a way that anyone would ever want their drugs to be administered. That's really the pros and cons of drug administration. It's pretty straightforward. Use your common sense. Ask questions along the way. Good luck. Be smart.